Alright, this is my pink cocaine part 2 video. Again, I saw with Liam Payne and the pink cocaine thing, there was a lot of confusion regarding illicit substances. So I'm still talking about stimulants. So let's talk about amphetamines. Some common amphetamines are like amphetamine or dextroamphetamine. This is your Adderall in a mix. We have methamphetamine, aka digoxin. It's a Schedule II controlled substance indicated for obesity and ADHD. I took this picture when I was on rotations with Kroger a few years ago. I've seen it a few times prescribed in practice. And then another common one is MDMA or methylene dioxymethamphetamine. The word amphetamine comes from alpha-methylphenethylamine. If you know organic chemistry nomenclature, then you can derive the structure by the name. So let's look at amphetamine over here. So alpha carbon refers to the first carbon that's attached to a functional group. This is butyric acid, but we have alpha, beta, and gamma. This is the alpha carbon. Here we have this carboxyl functional group. This right here is a methyl group, a CH3 group. It's attached to the alpha carbon. This is called a phenyl group. When it's on its own and not attached to a structure, it's called a benzene. Ethyl means 2 carbons, so boop, boop. Granted, a true ethyl group is CH2CH3, but we lose some hydrogens when we attach to other groups. And amine, we have a primary amine, alpha-methylphenethylamine. Anyway, here we have another methyl group, methamphetamine, or N-methylamphetamine. This extra carbon causes it to be more lipophilic. It increases lipophilicity. This increases blood-brain barrier penetration. So when compared to normal amphetamine, methamphetamine crosses much quicker. It has an increase in potency, and then it has an increased addictive potential. Side note, methamphetamine is a racemic mixture of dextromethamphetamine and levomethamphetamine. Fun fact, Vicks Vapo Inhaler actually has levomethamphetamine in it. So yeah, technically meth is over the counter, but that's for another video. So methylene dioxymethamphetamine, MDMA, Molly, ecstasy. The name comes from here we have a methylene group, CH2 connected to the rest of the molecule, dioxy, 2 little oxygens, and then methamphetamine. When compared between the groups, MDMA is more serotonergic over the other two. It has minor psychedelic properties as well. This is likely due to agonism on serotonin 5-HT2A. It's thought that this methylene dioxy substitution provides its serotonergic activity. I mentioned it in my Molly video, but there's some clinical trials that are ongoing for MDMA-assisted treatment for PTSD as well as some anxiety disorders. A little bit ago, the FDA did decline MDMA-assisted therapy. They argued that the participants were unblinded. I'm not sure how ketamine got approved with this logic. They said that the benefits do not outweigh the risks. I don't agree with that either. I digress. What's interesting is MDMA is actually metabolized into a drug called MDA, or methylene dioxyamphetamine. You see it doesn't have the methyl group, so it's not methamphetamine anymore. MDA's street name is SAS. It's a common adulterant of illicitly produced MDMA. I will mention that MDMA and MDA are less addictive than other stimulants like cocaine and methamphetamine. MDA is more hallucinogenic than MDMA, and it also lasts longer. It's also said to have some neurotoxicity associated with it. But amphetamines have a couple different mechanisms, we think. First, we think it might inhibit VMAT2, or vesicular monoamine transporter 2. VMAT2 regulates monoamine transmission and stores them in these little vesicles. We think that amphetamines inhibit the uptake of monoamines into these vesicles, and through a complex mechanism downstream, we think that amphetamines actually reverse transporters like DAT, NET, and SERT, so the dopamine, norepinephrine, and serotonin transporter, or reuptake transporter. So remember, these transporters cause the reuptake, but we think that amphetamines reverse the transporter and increase the release of neurotransmitters. We can call this an SNDRA, or a serotonin, norepinephrine, dopamine releasing agent. We also think that amphetamines inhibit the reuptake of these neurotransmitters. Another few interesting things is we might think that some amphetamines inhibit MAO, or monoamine oxidase. I don't know how common this thought is, but monoamine oxidase enzymes catalyze oxidative deamination. We see dopamine being metabolized by catechol O-methyltransferase. This is the catechol, and we have an O-methyl here. And then we see this little metabolite through monoamine oxidase and aldehyde dehydrogenase convert this little amine group to a carboxyl group. I think it's interesting that dopamine can be converted to norepinephrine and norepinephrine can be converted to epinephrine. Little side tangent. These are some examples of monoamines. Monoamine oxidase plays a role in the metabolism of monoamines. But an example of a monoamine oxidase inhibitor that's on the market is phenelzine. It's a really old drug. It's for depression. It's a non-selective monoamine oxidase inhibitor. An example of a selective MAO-B inhibitor is selegiline. It's for Parkinson's disease. So basically, these drugs prevent the degradation of certain monoamines. That's useful if you have Parkinson's. You need to increase dopamine, so block the degradation of it. Same thing with depression. There's another little drug on the market called deutetrabenazine, or Austedo. It's a VMAT2 inhibitor. It's indicated for chorea with Huntington's disease as well as tardive dyskinesia. So if I have time, I might make a video about like synthetic cathinones and like depressants that are also mixed into pink cocaine. But yeah, overdose of amphetamines does not sound like fun. Stimulants in general can cause some rage, aggression, and hostility, sometimes psychosis, paranoia, and hallucinations. The latter three are generally associated with drugs that increase dopamine, block NMDA receptors, and act on serotonin 2A receptors.